it can rival ceramic. Okay. So what I've done is I put in a bit of ceramide on metal. I've done what you call a telescopic superstructure. These screws are not cemented. I mean, the superstructure is not cemented to the implant, but screwed in. Okay. So you got your implant, then you can get the angulation again. At the same time, you can actually build up the pin aesthetic. Okay. You can place these crowns on top. These are ceramide crowns. They are made out of resin. They are beautiful. They can. The most important thing is that you can peel them off if you need to, using a semi-permanent cement. The one I use is Implant Dentistry. Okay, and that's how you place it in. You screw it in to up to 35 Newton centimeter, and then what you do is then you place the crown, and you can see that. And where you screw it in, you put in your temporary filling, any zinc oxide eugenol material, and then you can actually place your cement using an implant time. Look at that. You've restored that area. It looks like teeth, feels like teeth, tastes like teeth. Okay? And that's how she looks like. When she goes home, she has new teeth on that side. And incidentally, the lower was had no problem. We could put in a full fix for her, and she is absolutely wonderfully restored. She has upper implants and lower full fix implant as well. Full arch restoration routine. Yes, okay? Sometimes you need to talk about cases like this. Yeah? A 42-year-old female who's an accountant had lost a lot of posterior upper teeth when she was young. She had generalized periodontitis, which she was currently wearing a partial denture. Okay, this is a lady who's a chartered accountant, had to meet people, had to go for board meetings or company, but she was 40 plus, yeah. Patient wants to look, but she looks like that. You know, she had denture. Okay, she had a denture on the lower as well. She was not too worried with the lower denture, but she says the upper are getting worse, getting uglier. The margins are getting higher, and she can't smile with confidence. So she wants something permanent. She wants to look beautiful. She has a little bit of money. She doesn't mind spending a little bit of money on her health, oral health. If you look at her without her denture, she said even her husband won't see her like this. Okay, only the dentist and herself. Okay, this is a problem, and you can see this in the. She had perio problem before, but she's relatively cured in the sense that she doesn't have any active disease anymore. If you probe on these areas, she is medically well now, but she was bad. She says in the late 20s and early 30s. She had very long teeth. She had a buck, the center incisors. So I told her, look, we can place implants here and there, but the problem is that can you actually fix this without thinking of something outside of the box? So she said, doctor, think outside of the box because I'm willing to go. You know, it's a matter of trust between the surgeon and the doctor and the patient. So have a look at the front view. That's how she looked like, and you'll see these patients coming to your clinic as well. Okay. You can't do bridge either in this case. So it was decided a full clearance was necessary. 6 implants to be placed in the maxilla. 4 of the implant are to be immediately placed into the extracted socket site. Surgical procedure to be done under general anesthesia. So that's what we did. We placed her under GA. We took out the teeth. We placed implant immediately where the teeth were. Okay. You see where the sockets are, and that's where those implants then were placed. Okay? So then we suture her up. We placed a denture in place, immediate denture trying. And then it was decided that pink porcelain aesthetic was necessary to restore some of the alveolar gingival height as well as appearance. Screw access was also a problem because, as you can see, this is a problem with her. She's like, she had a very, you look at that, yeah? You see where the socket are? I can't push it back anymore. It was coming proclining, yeah? Proclining forward. So how do you actually fix that? I'll show you a little bit of it. Okay, so the screw access was a problem in her case, yeah? Because there will be a bit of a labial. But at the same time, being a full fix, you can't cement it in, because if you cement the superstructure in, it's a problem of retrievability. That means that maybe after 3 to 5 years you want to have a good clean, or if there's any problem with the implant, you can't retrieve the breach. Okay, so you need something that you can screw in, but you can also retrieve without using a permanent cement to seal the superstructure. Okay, so the prosthetic phase, the solution proposed, of course, I work with my prosthodontist, a telescopic crown cemented on fixed prosthetic frame. I call it the Firdaus prosthesis. I don't know. If you've seen any, please correct me on that. Okay, no screw hole is seen. The advantage and aesthetic pink and white is established. That means doing a wax trying, seeing where the screws are, you can see these screws are coming out like that. Okay? Yeah, coming out like that. So that's a problem. A wax frame trying is done. Okay. Framework is done. Okay, so a framework is done, cantilevered at the back. Okay, and the ceramide crowns were placed. Silver palladium framework with ceramide pink porcelain, ceramide white porcelain. You can see, beautiful work for my technician. Okay, it has to be world standard, you know. We realigned the whole thing because we can actually put the screw in labially. We gave her a little bit of pink gum on the top. Then we placed we cemented with a semi-permanent cement on these framework. And she looks like that. You know, that's more presentable. She had not the procline teeth that she once had. She had a good aesthetic smile line. And if you look at that, before and after, you know, I think that is a tremendous improvement in her aesthetic. So in conclusion, implant osseointegration is no longer a challenge that it once was. Provisional aesthetic is now expected by all patients. Yeah, that means that there's no way that you should be taking out teeth and then leaving the patient edentulous as they come out of your clinic. You must have some sort of provision. Okay, the provisional aesthetic is now expected, as I said. They must not be allowed to leave the surgery without that. The pink aesthetic have been recognized as important as the white aesthetic. That means that pink porcelain must look as good as the white aesthetic, or as good as the tooth itself. Okay, you're not just replacing the teeth. You know, you are as I said, a stomatologist. You should be looking at all the mouth as such. And complex implant procedure can be constructed without ugly access hole in the aesthetic zone. Okay, so I'd like to say thank you to my Dr. Sarah for sharing patient, my wife Myra, and Azlan for taking all those pictures. Thank you very much.